So here are the 7 schools of scoliosis-specific exercises. And in the US, we primarily or predominantly work with Scoliosis101 because that is the one that we have the most research in, and it's also the one that we just teach more often here now. And it's something that I've been working in since 2013. And there are 2 particular Schroth schools, and the Barcelona school is an offshoot that developed after the Katarina Schroth school. And the Schroth program in and of itself from Katarina Schroth is approaching 100 years old at this point. So just to give you a short kind of history of that school. Now, let's go over a couple of things, but before I do that and talk about Schroth itself, I do want to stress that all of these are scoliosis specific. All of these work on building up a person's ability to find their middle posture, their midline posture, because the scoliosis is creating a shift in the kind of the balance awareness of your spine. So you don't know when you're sitting off to one side and sitting into your curve. So all these programs stress the emphasis of finding a firm foundation and sustaining the elongated posture as best as possible with multiple movement patterns of exercise. Now, let's talk about the treating of scoliosis and how that posture is important and why it's important. So the number one goal with treating scoliosis, and in particular for Schroth PT, is to stop the progression of the curve. If we are able to reduce and actually reverse the degree of curvature for our adolescents, fantastic. But for those of us who have matured to a certain degree, there can already be what we call bony changes in scoliosis. And we see that in these x-rays here. Here we could see on this outline, of this orange outline, that the bone has begun to wedge. It isn't these kind of perfect rectangle anymore. Because of the above and below vertebrae falling into the curvature, the side bending, it creates a wedging, a wearing away of the spine, and that does not change. We can't regrow the bone to make it a rectangle anymore. And this wedge decreases the potential for us to decrease that curve. So our number one goal is thus to stop the progression curve so that it doesn't get any further into a curvature than it already is. So we're trying to decrease the wedging or stop the progression of that wedging. And our other goal is really just to build that postural strength to maintain that position of neutral as best as we can. Now, our neutral, our midline rather, is important. We are trying to find the best alignment of stacking on top of our body, of each part of our body, the pelvis, the area of thinking of your pubic bone, the midpoint of your pelvis, your belly button, your sternum, the breastbone, and your chin. And all these things should stack on top of each other perfectly like Lego blocks. And we're trying to build ourselves toward that line and sustain that line with movement, with walking, with lifting, with sleeping, with sitting, with standing. So static positions, stationary positions, and dynamic positions are all being worked on. So treating with scoliosis, treating with Schroth rather, we are working with breathing patterns. So for Schroth scoliosis, on top of finding your midline and building up your posture and trying to prevent the progression of the curve, we are working with breathing patterns because our rib cage becomes compromised when we have scoliosis. The ribs side bend and rotate into the curvature. So it side bends in this example here. The side bending causes the rib cage on the left side to shorten. And if we are able to activate our trunk muscles to lengthen our spine in this midline that I was talking about, we're able to separate those rib cage a little bit more, and we're building up the structure that allows you to sustain this middle line posture, this better posture. And if we sustain that posture, we are building the strength to prevent the progression of the curve. So what Schroth does is put our patients in particular positions, Schroth breathing positions that allow you to maintain and challenge and sustain your breathing pattern to open up the rib cage and stimulate your core muscles, the abdominals, the back. Everything is really engaged during these breathing patterns. And then you build an endurance. Your body begins to build an endurance to sustain good postures. And here you can see, and this is a Schroth exercise here, or a seated position. And a typical Schroth treatment goes through an eval, and it starts with an evaluation where we look at the patient history, their age, their growth, their scoliometer reading, their height. And we take all those numbers, we take a couple pictures, we look at the profile, the external view of the person from the front, from the back, and the sides, because this is just without the actual x-ray. And then we review the x-ray as well to make sure that the external factors are matching what we see on the x-ray. Next, we also look at, we begin to talk about these positions, and we talk about what's the best way to sleep, sit, or stand, excuse me, in with your particular curvature. And that's right away what you should get on the first day of your evaluation. At the very least, you're going to get how to sit, sleep, and stand, and you're going to get a full evaluation of your spine. If there's enough time with these evaluations, and we begin to go into Schroth breathing and Schroth breathing positions. And this traditionally starts with a lying down position, but breathing positions will be in a lying down position, a kneeling position, or a seated and or standing position. This is the progression of Schroth breathing because you want to be able to functionally sustain good postures in each of these positions. Now, for your homework, you may not get all of those because that is a lot to do. We'll probably give you only one or two. And if you're progressing a lot, we'll give you more than that. But usually we try to stick to a minimum and just get better at one or two particular Schroth breathing positions. And in addition to Schroth breathing, we talk about building up strength in the accessory points, because you can't build a strong core in just breathing static positions alone. So we need to be able to do some more core strengthening, right? So we do some abdominal strengthening for the lower abdominal in particular, which can need a good amount of re-education to activate on the insides of the curves. It's really kind of hard to activate those areas. And scapular education, re-education, strengthening of the shoulder blades. In particular, that's especially that shoulder blade that has risen above the rib cage and doesn't know how to activate and sustain itself down and away from the neck. So we work on all this accessory areas to complement our Schroth breathing positions. And that is it. And if you have any questions, please reach out to me at 646-727-0820 or email me at clifford@cliffpt.com. I hope this was informative. And if you have any questions at all or would like to reach out for your own free e-consultation, go to cliffpt.com. Thank you.